Now, there's a lot of, it really depends on what kind of surgery you have. And within that, there's a lot of different options that you have based on your individual needs, and in some cases based on your breast size, because it's really difficult to reconstruct a large breast, a C or D breast, with the typical implant process. So they typically use what we call analogous tissue, which we'll get to in just a minute. So with a lumpectomy, we're dealing with a lumpectomy defect, and I had this as well. So my biopsy was actually an excisional biopsy, and we took the entire tumor out of my breast rather than do a fine needle biopsy. So I was left with a divot of about the size of a silver dollar, something like that in my breast, and I didn't stop there, obviously. But if that is where people stop, in many cases that it is, they can get fat grafting in different places in their body, the buttocks, inner thigh. They can also get a very small implant inserted, depending on how much tissue they removed. For a very large tumor, it could certainly be a good decision to put a 50 cc or 100 cc implant in, just to allow symmetry with the other breast that remains. They can also do something called tissue expanding, and this is something that I went through. Essentially, they're placing an empty saline holding bag under your muscle. So they pry the muscle off your rib cage, and then they put these little ports at your side. So there's little tubes that go down your side and are under the skin. So they inject saline over a 6 to 7 month period, which basically creates a pocket for the implant to live. So you are being expanded not just in the skin section, but also your muscle is being expanded to allow that layer of softness to exist between the implant and your skin. Because there's no breast tissue left, there's no fat. So you would just be essentially be able to see the implant, the rippling, the unnatural appearance of an implant under the skin. So they typically put the implant under the skin and do so with the tissue expansion process. Mentioned breast lift and reduction for the symmetrical piece of it. That's something that they typically do with lumpectomies as well. Mastectomies, you can either do 1 or 2. Most young women decide to get 2 with the belief that they're not going to have recurrence. Older women tend to go for lumpectomies or don't get reconstruction. It's certainly a generational thing. Analogous tissue, we're dealing with a tram flap, DIE flap, and a latissimus dorsi flap, which is really tunneling existing muscles from your body to that place in the breast to reconstruct the breast. So stomach, mid-thigh, and this muscle back here, the lat flap surgery to move that around. And this actually does have sensation in some cases because they do microsurgery to connect those nerves. And in some cases, it actually is a warm, natural feeling breast because of that, but you do have more scarring. Nipple reconstruction is something that they also do nowadays, and the easiest kind is the 3D tattooing, which is what I have. They also have a type of operation where they take a 4-point star and gather it up from your skin on your breast and then form it into a nipple mound. Then you have permanent THO, I guess. It's not the best option for me. And then they tattoo around that to give a natural look of the areola. They also, in some cases, have taken the nipple off and stored it temporarily on your stomach, which I think is a little terrifying, and then relocating it once the surgery and chemotherapy is over. But that's not something they do much anymore because the breast cancer cell's ability to hide inside the nipple. And we talked about the star flap and the skate flap. Yep. In some cases, like we said earlier, some people choose for no reconstruction. There's some really fantastic tattoos that I've seen over those flat scars that really represent a person's personal decision about how or if they reconstruct their breast. The breast band is completely removed. It's perfectly flat. It's actually a beautiful thing. I have a number of friends who have decided not to do that and have chosen some really amazing tattoos instead. So, very personal decision. Hopefully this gave you guys some additional information to think about as you undergo your breast cancer journey.